we're going to have a look now at how we would deal with a casualty that requires CPR. The first thing that we would need to do is to check around the area for any dangers before we approach the casualty. We can also be looking at things that we feel might have actually caused the casualty to be in this position. So have a look around the environment very, very quickly as you're approaching the casualty, but as I say, make sure that it's safe before you actually go to approach. When you get to the casualty, we're going to check their responses by tapping on the shoulders and talking in a firm voice. Hello? Can you hear me? Are you okay? Can you hear me? And I'm going to shout for help because the casualty isn't responding, so at the moment they're unconscious. Can somebody help? It's important at this stage that we open the airway. Because the casualty is unconscious, what can happen is that the tongue, being a muscle, can fall back and actually block the airway. So to open the airway, we need to place one hand on the forehead, two fingers under the chin, and we're going to raise the chin up, chin, tilt and lift towards the ceiling. We're then going to go down over the casualty's mouth, placing our cheek and ear above the nose and mouth to listen for breathing. We can place our hands, fingertips on the tip of the chest to see if we can feel the chest rise and fall. So it's look, listen and feel. Again for up to 10 seconds. And this is to establish whether the casualty is breathing. If the casualty is breathing, we also need to think whether the breathing sounds normal breathing. If the casualty isn't breathing or the breathing isn't normal, we require an ambulance at this stage. We need to make sure that it's on its way. Somebody's come to help me. Lynn, can you get me an ambulance, please? Can you tell them that we've got a casualty that's not breathing? And can you come back with a defibrillator? Yes. Okay. If there is a defibrillator on the premises, we need to request it. The sooner that we actually commence CPR and we get the defibrillator onto the casualty, the greater chance of survival they'll have. I'm going to show you now how to start CPR. So first of all, we're going to place the heel of the hand down into the centre of the chest. If you can imagine a cross between the nipple line and across here down the sternum, down the chest bone. And we're going to place the heel of the hand in there, kneel up and over the casualty. Interlock your fingertips and pull the fingers back if you can. I'm going to commence with 30 chest compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We then need to go straight away to do 2 breaths. The head at this stage should still be back, so we need to close off the nostrils to prevent air escaping and place our mouth around the casualties to form a seal. It's important that we open our mouth wide enough to cover both sides of the mouth. 2 breaths. And you can see that the chest rises and falls. I'm coming back now to do 30 compressions. Straight back. So you can see that the breaths are very quick. They're only up to 1 second. And the depth of the compressions, we're going down about 2 to 2.5 inches. That's about 5 to 6 centimetres. So nice and deep so that it allows the chest to be pushed as breastbone goes onto the heart to actually pump the heart to keep the oxygenated blood flowing. Okay, and that's how we'll do CPR.